Dear viewers, I hope you are all fine. This ultrasound video shows a case of inflamed appendix with a small sealed perforation. Now you can see the scanning of the appendicitis, and you can see the ascending colon. By using a high frequency probe, that is high power linear probe, you can see a tubulous structure in the right iliac fossa surrounded by a hypoechoic rim. Appendicitis happens when the inside of the appendix is blocked. Appendicitis may be caused by various infections such as viruses, bacteria, and parasites in the digestive tract, or it may happen when tube joins the large at the point of where it joins the large intestine, that is near the sigmoid colon, and appendix is blocked or trapped by stool. Most of the patients with appendicolith are asymptomatic. However, an appendicolith may be associated with complicated appendicitis with serious outcome. Now, you can see some prominent lymph nodes are also seen near the affected area, near the appendix. Now you can see this is the sealed perforation. This is the collection of the thick and turbid fluid in the superior side of the appendix. You can see so it is possible that the interior wall, the perforation site may be in the interior wall of the appendix. But as the fluid is very small, so it is a sealed perforation and appendix, and that has leaked from the inflamed appendix, and the leakage has repaired naturally. The fluid is very small, and you will see the inflamed appendix, and there is no communication visible at the time of examination with this sealed perforation and the inflamed appendix. Now this is the sigmoid colon, and the fluid is seen superior to the sigmoid colon. Now by sweeping the probe around the appendix, around the sigmoid colon, you will see the inflamed appendix. Now this is the vertical view of the inflamed appendix. Now by sweeping the probe, you can see the transverse view also. Now you can see a tubular structure in the right iliac fossa surrounded by a hypoechoic rim. This is the transverse view. Now you can see a small amount of fluid is surrounding the tubular structure, which is a sealed perforation. And by sweeping the probe, I can see a longitudinal view of the tubular structure. Bowl walls are thin. Both ends of the tubular structure are blunt. By applying some pressure with the probe, you can see this structure is not compressible. It doesn't collapse. A significant mucus and debris are seen in the interior, but a small fecalith is also visible, but You may find the Fecalith in some cases and not in all the cases. This area is extremely tender with the patient experiencing intense pain. Now you can see the whole length of the inflamed appendix, and the sealed perforation is seen along the interior wall of the inflamed appendix. Appendicitis happens when the inside of the appendix is blocked. Appendix may be caused by various infections. Now, a blockage in the lining of the appendix that results in infection is the likely cause of appendicitis. The bacteria multiply rapidly, causing the appendix to become inflamed, swollen, and filled with pus. If not treated promptly, the appendix may rupture. As in this case, fortunately for the patient, this perforation was not full-fledged perforation, it was only the leakage of the fluid from the appendix, and leakage was repaired as the patient was having some antibiotics and anti-inflammatory drugs. It is generally accepted that the main etiology of appendicitis is obstruction due to Fecalith in adults and lymphoid hyperplasia in children. It is also accepted that perforated gangrenous appendicitis is associated with an obstructed appendix secondary to the presence of Fecalith. The most useful sign of acute appendicitis on ultrasound is the outer appendiceal diameter of 6 mm or greater on cross section. Depending on the technique used, the diagnosis accuracy of CT scan in acute appendicitis ranges from 93 to 98%. On ultrasound, it is said in the books and the data that the diagnosis accuracy is more than 50%, but I think in experience hand it is much more than that reported in the book data. So sometimes stool can get stuck in the appendix, which is shaped like a tube with one closed end like a balloon that has been tied off. There is no way of what's trapped inside to escape. The pressure builds up as the appendix inflammation continues, producing a more and more inflammation, and it can lead to the perforation. So the infection is one of the most common cause of appendicitis. A viral or bacterial infection causes the appendix to swell to fill with pus. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.